Hi everyone. In this video, we are going to disclose the secrets of the gray matter of the spinal cord, and we are going to learn them at the same time. So this inner eight-shaped gray area of the spinal cord, which we see when we do the cross-section, is the gray matter of the spinal cord, while the white matter is present outside this, in which we have the arrangement of important ascending and descending tracts. At this point, we are going to study only the inner gray matter. This gray matter contains all the nerve cell bodies which are important for supplying the muscles, especially located in the anterior gray column, as well as it includes the neurons in the posterior gray column, which receives the afferent fibers concerned with the pain, temperature, touch, proprioception, 2-point discrimination, and vibration. In some areas of the spinal cord, there is lateral gray column as well, which is concerned with the parasympathetic and the sympathetic outflow. So first discuss the anterior gray column of the spinal cord. In this anterior gray column, we have arrangement of three group of neurons. The medial most is known as the medial group of neurons. This is the central group of neurons, and the lateral most is the lateral group of neurons. So the medial group of neurons, let's reveal the facts. The medial group of neurons is present throughout the length of the spinal cord, and it is responsible for supplying the muscles of the neck and the trunk muscles, including intercostals and the abdominal muscles. The central group of muscles is present only in the cervical and the lumbosacral regions of the spinal cord. In the areas of C3, C4 and C5, the neurons form the phrenic nucleus, which is responsible for supplying the diaphragm. A similar nucleus is present at the level of C1 to C5 area, which is known as the accessory nucleus. This nucleus gives rise to the spinal part of the accessory nerve, which in turn supply the trapezius muscle as well as the sternocleidomastoid. And lastly, the central group of neurons, which is present in the area of the lumbosacral region, they form the lumbosacral nucleus, and the distribution of this nucleus is unknown. Lastly, in the anterior gray column, we have this lateral group, which is also present only in the cervical and the lumbosacral regions. This lateral group is responsible for supplying the muscles of the limb, upper limb, and the lower limb muscles by forming the important plexus, that is the brachial plexus and the lumbosacral plexus. So the anterior gray column, responsible for supplying the muscles of the body, is divided into medial group, central group, and the lateral group. Out of these three groups, only the medial group is present throughout the length of the spinal cord. Now we are going to reveal the facts of the posterior gray column. This posterior gray column contains four important groups of neurons. The easiest mnemonic to remember this four group is green, parrot, drank, vodka, where G is for gelatinosa, P is proprius nucleus, D is dorsalis nucleus, and V is the visceral afferent nucleus. At the apex of the posterior gray column, substantia gelatinosa is present. Now this group of neurons is present throughout the length of the spinal cord, and it receives afferents concerned with the pain, temperature, and touch. Just ventral to the substantia gelatinosa, the larger group of nucleus is the proprius nucleus. This group of nucleus is also present throughout the length of the spinal cord, and this is concerned with the sensation of proprioception, 2-point discrimination, and vibration. Just ventral to this, we have two groups of nuclei which are not present throughout the length of the spinal cord. If we talk about this green one, this is the dorsalis nucleus. This group is present at the levels of C8 all the way to L3 and L4, and it is responsible for receiving the proprioceptive information from Golgi tendon organs and the neuromuscular spindles. Lastly, we have this visceral afferent nucleus, the smaller one, which is present at the levels of T1 to L3 and is responsible for receiving the visceral afferent information. Now, in certain regions of the spinal cord, particularly the thoracolumbar and the sacral region, we have the group of neurons in the lateral gray column as well. These group of neurons are concerned with their sympathetic and parasympathetic outflow. So the group of neurons found at the level of thoracolumbar area, they are responsible for giving the preganglionic sympathetic fibers, while the group of neurons at the level of S2, S3 and S4, they will be responsible for giving the preganglionic parasympathetic fibers.